And that's why I always emphasize that personal discomfort is one of the things that you always have to consider when you're wondering if somebody, meets criteria for a given psychiatric disorder, or just kind of considering them altogether in treatment or interacting with them.
Hey everybody, before we start the show, I want to make a couple disclaimers. This show does cover a wide variety of topics related to mental health and life in general, and some of those could be sensitive for you. I want to simultaneously encourage you to be brave in consuming difficult content, but also respect and recognize your limitations. So please use your best judgment. I will never be offended if you need to skip a question or an episode entirely, but feel free to feel it out, check out the episode, and just see what happens. If you need to skip, that's okay, but feel free to give it a shot first. I also need to say that while I am a psychologist, I'm not your psychologist, and I'm not your therapist. This is not intended to be direct medical advice, and you should not use this as a substitute for professional help. So with those said, let's go ahead and get into the show.
All right. Hello, friends of all varieties. This is the Hardcore Self-Help Podcast, episode 342. I'm your host, Dr. Robert Duff, aka Duff the Psych. I make mental health content for real people just like you. And today I have a question and answer episode. Two awesome questions from listeners like yourselves. Let me look through real quick. There is some talk about suicidal ideation in this episode, but nothing too extreme, nothing graphic, just like last time. So I don't think there's going to be anything too triggering here. But, of course, if that's not something you want to hear about, I'll see you later. But two really good questions that I think are super worthwhile. If you would like to send me a question for an upcoming episode of the show, please send me an email to duffthepsych@gmail.com or use the contact form on my website. Speaking of my website, it will be getting updated at some point. I feel like my wife and I just had like a little kind of business brand meeting, and it is like currently being held together with like duct tape and, chewing gum. It's totally functional, but on the back end, it's a mess, and it's using a lot of old plugins, and it may self-destruct at any day. So it will be updated at some point, but it is still fully functional right now. So if you haven't yet, check out duffthepsych.com. There are lots of awesome blog posts there. And as well, there are all of my different products. There are no advertisers for this episode, so I want to remind you all the stuff I have going on. So with the books, I have the two hardcore self-help books, Fuck Depression and Fuck Anxiety. Both still awesome books. I think that the depression book is the better of the two, but people love the anxiety one a lot more. So, you can decide for yourself if you have both of them. The audiobook versions for those are great because they're just like this podcast, me reading the book to you. I also have my two journal prompts books, prompts books. One is 500 journal prompts. One is the 500 questions for dating, romance, etc. I have a book that I co-wrote with one of my coworkers about dementia called Does My Mom Have Dementia? I have the online course, Kick Anxiety's Ass. I'm probably forgetting stuff too. Go to the website, check out the social media, follow along. There's a lot of stuff aside from just the podcast that is all affordable and accessible to you. So that's my advertisement for the day. Keep me employed, please. And with that, let's just jump into the episode. First question reads, Hi, Duff, and thanks for taking the time to read my question and for continuing to do the podcast. You're very welcome. I have severe treatment-resistant depression. I'm a workaholic type A person, so despite the severity of my depression, I've been able to appear put together, like nothing is wrong. On the inside, I feel like I'm on the verge of a mental breakdown, and I'm strongly considering suicide, which I see as an inevitability. I've had suicidal ideation since I was 15, and I'm 40 now. How bad do I let things get before I need hospitalization? How do I deal with the pain of daily life until things are bad enough? And how do I prevent myself from having a breakdown at work? Is there an alternative to hospitalization or IOP, which is intensive outpatient program? I'm currently being treated with Spravato and going to therapy twice weekly, and both of these treatments are uncovering trauma and grief that's worsening my symptoms. I know it's supposed to get worse before it gets better, but it's breaking me. Any advice you can offer will be greatly appreciated. Thanks for all you do. All right. Well, thank you for the question. I really appreciate you writing in. It's definitely a unique experience being very functional in a certain domain, like, occupational functioning or what have you, while also struggling with serious psychiatric symptoms, like, big stuff. it makes it easy to fly under the radar. And maybe you've even had people who don't believe you, like, oh no, you're not that depressed. Look at what you do. You're great. Kind of minimizing in a positive way. I'm not sure, but I imagine you probably had that experience. And that's why I always emphasize that personal discomfort is one of the things that you always have to consider when you're wondering if somebody, meets criteria for a given psychiatric disorder, or just kind of considering them altogether in treatment or interacting with them. Impacting on, the functioning of school, work, relationships, other areas of life are very important. And those are part of the diagnosis criteria. But you also have people who push through these things. They feel such immense pain while pushing through, but they're able to get through it. And that's where you're at. And, the extreme personal discomfort is another thing that can be a qualifier for a psychiatric disorder. So you count too, right? You out there working your ass off and also just putting yourself through the ringer on the inside, you count too. The fact that you've been strongly considering suicide is also very telling as to the level of severity that you're experiencing. So I just want to say that I believe you. I hear you. I see you. I take what you're saying seriously. And I hope that I can help, at least to some degree. You mentioned that you've had suicidal ideation since you were 15 years old. It's a long time. You're 40 now, I think you said. 40? Yeah, that's a long time. And I think that's also a testament to your personality, your tenacity, probably stubbornness, maybe even a little bit of hope that's kept you around. And I think it's amazing that you're still here. That's a very long time. And I also want to recognize that you're probably fucking exhausted. You're probably so tired of holding on. And despite this being sort of an ever-present part of your life, there is still a possibility that you won't feel this way forever. That the suicidal ideation is not going to always be the backdrop of your life in every moment. And I can't make any promises, but it is possible, and I have seen it. People that have been doing the work and trying to get treatment and all of that stuff. And at some point, something does click, and it's not the primary issue anymore. It's not right in their face all the time. So there is hope that can happen for you as well. I just want to give you that hope. You're clearly at a level of severity where these higher levels of care are necessary, meaning you're not just doing once a week outpatient therapy, right? That's why you're talking about things like hospitalization or an intensive outpatient program. And I can understand why you wouldn't want to rely on those, because for you as a person, you're not going through a new crisis in your life necessarily. These are chronic feelings that have been there for what feels like forever, and maybe they're ramped up a bit, but it's not the same. And I'm not sure how much treatment you've had over the years, but you sound very educated about your mental health, and you've probably had a lot of treatment. And so for a seasoned veteran like yourself, you honestly might not get too much out of a hospitalization or an IOP unless you are in that position where you're imminently suicidal and you need to be in a safe place and have quick access to treatment. But from the actual content of what you go through there, you may not get a whole lot out of it. I'm proud of you for trying treatments that are somewhat off the beaten path, like the Spravato. For people that don't know, Spravato is the FDA-approved nasal spray. So FDA meaning the Food and Drug Administration here in the United States. It's a nasal spray that's derived from ketamine. So it's called S-ketamine. It's a polymer or isomer of ketamine. And it can help with suicidality. It can help with treatment-resistant depression. And it's very good for those things. And a lot of people are currently getting Spravato as a treatment because it's an FDA-approved drug, which means that it can be covered by insurance. This is different than IV infusions of ketamine, which is another form, and that treats the same things, but it's an off-label treatment, meaning FDA hasn't approved IV infusions for depression. A doctor can give you IV infusions of ketamine for depression, but it's considered off-label, similar to using, say, birth control for a psychiatric reason, or using a SSRI for premature ejaculation. Those are things that are not the intended use of them, and they're not FDA approved for that use, but they are effective. So it's still legal to do so. So, as an off-label treatment, IV infusions of ketamine are typically paid for out of pocket and can be quite expensive, like thousands of dollars. And then in addition to the Spravato, you're getting twice-a-week therapy. And I think that's awesome. So you're really, really doing a ton of work, and I think it will pay off. It's just really hurting right now. You mentioned that the treatment and the Spravato are starting to uncover trauma and grief that are making your symptoms worse. I think that makes a lot of sense. I get the feeling from this question that you've had a lot of treatment over time, but maybe you've never gone as deep as you are now. And it kind of makes sense. The ketamine is meant to sort of amp up the process of trauma work because neurologically, it makes your brain primed for change and processing. So you're probably doing a lot of really deep work right now. It lowers those barriers that might be there otherwise that would protect you from the trauma and keep you maybe a little bit avoidant of it. Instead, this is sort of lowering those barriers and having you go straight through it, which can be why you're feeling so much of that sting. It's uncovering things that are really, really painful instead of being able to keep it locked, sort of deep in a box. So actually working through it can hurt. And I have a few suggestions, okay? So first off, if you aren't already, I would be sure to be open with your therapist about what you're talking about here. I know a lot of people who are similar to you that are driven type A people and want to push through everything. So you may be inclined to also push through here and sort of do a good job, those are in air quotes, good job in therapy, rather than giving your therapist just this important feedback that they need. It's kind of like somebody who is in personal training, physical training, and they push through pain and discomfort because they just want to make their trainer proud, and then they end up injuring themselves, right? We don't want to do that in the psychiatric version here. I think it could be that you guys need to slow down a little bit on the trauma processing and maybe return to some coping skills and just skill building so you can keep yourself afloat during this challenging process. Like, I'm not sure what type of provider you're working with, but a lot of people who practice, say, EMDR, which is a big treatment for trauma, they start very slow, meaning they start with making sure that you have adequate coping skills like breathing and grounding exercises, and that you feel safe before you start cracking open that trauma and working with it. If you've essentially told your therapist that, yes, it's intense, but I want to keep going because I want to get better, they may not be getting the full picture. You can talk to them openly without feeling like you're telling them what to do or dictating your own treatment. You can say that you're struggling with how intense these emotions are from your trauma work, and you don't know if you can handle this intensity without becoming suicidal or completely unraveling for very long. And then talk to them openly, ask what they think. How could you continue moving forward in a way that is challenging but still feels safe enough to not be completely unraveled? And I'm not sure what your financial situation is, but you could also consider a different type of ketamine treatment. They're not all created equal. Spravato is amazing because it's approved and it's accessible and relatively quick, but it's not necessarily the most effective. You can check me on this, but I believe IV infusions are considered to be at the top of the list in terms of efficacy. But even for IV infusions, there are different approaches, and this is ever evolving, right? When my wife initially did IV infusions for ketamine, I wouldn't have repeated that again. Like, it was helpful. It was extremely helpful and completely vital for what she was going through. And I think it saved her life at that time. But it was very much like it's a clinic. You go, they set you down, they give you like a blanket or an eye mask, they hook you up, and then they come check on you again in a while. And that was about it. I wouldn't necessarily suggest those ones if you have the choice. Instead, I would want one that's more integrated. They have clinics out there that have therapists on hand to help you work through what's coming up and process. And alternatively, there are programs like we've talked about with our recent sponsor, MindBloom, where you can get at-home ketamine treatments. And these are cool because you can work with them. They have people that you can process with. They have guided meditations that go along with it. And you can also work with your own therapist around this, right? So you can go see your therapist shortly after and go straight into the processing. I've had people that have done, I don't know if it was MindBloom or some other form of at-home ketamine treatments where, the day after ketamine or the same day later on, we'd go straight into a session and kind of just break down what happened and process it. And that's a really good way to maximize the benefit of that treatment. We talked a bit about how IOPs might not be the right move for you, but what about the idea of sort of crafting your own IOP, right? So essentially setting aside time and taking that time to focus heavily on your mental and physical health in a structured way, like setting aside a period of time to do that. Because with an IOP, you would basically be going into treatment for several hours every day of the week, or at least several days of the week. And so it's going to be, obviously interfering with your time to do other things like work and stuff like that. but it's not quite as all-encompassing as a hospitalization for several days. So what if you could kind of make your own thing? What this would look like is perhaps taking some time off of work, maybe a couple weeks or so, maybe longer if you can. You can do that with sick days, vacation, or otherwise. This is important, so whatever you need to do. And in that time, you would essentially continue seeing your therapist a couple times per week and having your ketamine treatments. And then at the same time, you would also amp things up and integrate other regularly scheduled activities. So maybe support groups or therapy groups, physical exercise, yoga, volunteering, time spent on hobbies, not habits, time spent on hobbies, time with family or people that, you are energized by, basically upping both the self-care and the treatment for a period of time. And this would be something that you could work on with your therapist, sort of the idea, and brainstorm to find a way that it fits into your particular life. But it would be taking a time away from normal life and really, really, really focusing on giving yourself the container to do this deep work. Deeper than you're going to do in an IOP, but it's an individually focused thing where you're going to be diving deep, but also really, really taking good care of yourself. During this period of time, it might be helpful to pull in the help of a friend or family member to keep you accountable. Sometimes something like this could even look like moving in with somebody temporarily, with, if you have a sibling that's really caring or whatever, moving in with them for a couple weeks and having them, help you out. Or from afar, just making sure that you're showing up for yourself during this IOP, in quotes, IOP, rather than just sleeping the day away or using it as a regular vacation, because those are great, but that's not what we're talking about here. Speaking of the vacation part, though, if you do have the ability to, integrating some form of retreat with this could be cool too. Getting away from the environment where all of your typical stressors live can be helpful to let them be in the background. So, going and getting a cabin somewhere or a nice Airbnb, whatever you can do. Obviously, I don't know your financial situation, but if you can get away and do this at the same time, that would be amazing. And with all of this, if it doesn't seem to be doing the trick, even the stuff that I'm talking about here and some adjustments, there are other things as well. You can look at adjusting the treatments that you're doing. Aside from other forms of ketamine, I would ask, have you ever done ECT, so electroconvulsive therapy? That is something that is also very effective for treatment-resistant depression and is considered to be quite safe, despite it being a bit scary. You can also look into the research on things like psilocybin and or MDMA, which are things that have been shown in the research to be great for trauma work. It's not legal everywhere, but there are ways that you can safely and legally engage with them. For instance, a while back on the show, let me look at what episode. Episode 171, I had somebody from the company Myco Meditations on the show, and he talked all about, they do these psilocybin mushroom retreats in, I think, Jamaica, or someplace where it is legal to do so. And so it involves groups, it involves different activities, and it involves, psilocybin that's put into capsule form to help work through things like severe trauma. So there are things out there that perhaps you haven't tried yet. And I always say it to people that I'm working with, you can't be stuck if you haven't tried all the options yet. And so there are still some stones that are left unturned if these other things aren't doing the trick for you. But I think overall, it totally makes sense that things seem to be elevating for you because you are fighting back against this trauma. And when you fight against the trauma, it does tend to fight back. I like to think of it as like a parasite. It's a parasite in your body and it pushes back against your attempts to get rid of it. It wants you as a host. It doesn't want to go away. Or like a demon, think about like The Exorcist. It's like fighting back when you're trying to exorcise it. The power of Christ compels you, and it's like, so you're trying to fight off this stuff and it's fighting back. And I think that pushback means that you're probably getting somewhere. You're getting down to the bedrock of the shit that you've been through and all the stuff about how it's torn you up inside and left you feeling broken. So you're getting down to the very bottom, and that's how you make lasting change. It's very hard, and I'm proud of you for doing it. But it can make lasting change. So as long as you're able to keep yourself safe and keep fighting, I really, really think it's gonna make a difference. I believe in you 100%. So think about these things, talk them over with your therapist. Please be honest with your therapist about this stuff. And maybe there's a good option here that you can sort of invent for yourself rather than those options that you talked about, like hospitalization or IOP. Thank you for writing in the question. All right, so on to the next question. Here reads, hey, I'm currently reading your book, Hardcore Self-Help, Fuck Depression. It's great so far, but I had to ask about this before I forget. You might cover it, but I don't think a lot of people know how depressed... Sorry, I'm going to keep reading through this. There's zero punctuation in the whole thing, so every sentence runs together, so I'm having a hard time separating it out. It's great so far, but I had to ask this before I forget. You might cover it, but I don't think a lot of people know I've been depressed since I was 9 when my dad passed away. I've been diagnosed as a person with ADHD, depression, anxiety, insomnia, and manic depression. I've been on medication and checked into a hospital because of my depression. Well, long story short, I went into my doctor 4 years ago due to some medical issues, where the doctor tested my thyroid and he told me I have hyperthyroidism, which affects my mood and mimics manic depression. Sometimes, since getting on medication, I no longer have to take medication for manic depression. I still have major depression and anxiety, but my world has changed since getting that diagnosis. I would like to know what your opinion is on how your thyroid can affect your moods. I totally understand if you don't get back to me, but just excited to finish your book. Thank you for reading the book. I think I do cover this in there, by the way. You probably haven't gotten there yet, but regardless, I will definitely answer the question here. Thank you for this. Similar to the last question, you've had to deal with some serious stuff for quite a long time. I'm sorry about that. I mean, ADHD, depression, anxiety, insomnia. Talking about from when you were age 9. That's a lot. And I'm glad you're around. I'm glad you're still looking for ways to help yourself and finding resources like my books and this show. I'm sure there's all kinds of other stuff that you've also looked into. One thing I want to clarify for people is just the terminology. So you said manic depression. That just means bipolar disorder. It used to be called manic depression because it's basically what it is. You know, you have depression and you have periods of mania or hypomania. But I think the term was changed in the 1980s to bipolar, basically because it was just so highly stigmatized and maybe a little bit reductive in terms of the sort of the spectrum of things that can happen with bipolar. But they refer to the same thing. If you hear manic depression, it just means bipolar. And I think this is a really interesting question because I think it ties together physical health and mental health. I'm always a huge advocate for getting your physical health checked when you're getting your mental health figured out. So I'm glad you've gotten some medical help. Let's dive into what your doctor is talking about when they say hyperthyroidism. So the thyroid is a gland in your neck. It's not little, it's largish. It's a butterfly shaped gland in your neck, and that's part of your endocrine system. So it produces hormones, and those hormones regulate a variety of things in your body. Technically, the thyroid secretes 2 different hormones, but we usually just lump them together and call it thyroid hormone. So people will say you have high thyroid hormone or low thyroid hormone. Technically, there's 2 of them, but that doesn't really matter too much. When the body secretes too much thyroid hormone, it's called hyperthyroidism. So hyper, a lot. And when it secretes too little, it's called hypothyroidism, right? Think of like hypothermia, not enough heat. Hypothyroidism. So when you have too much thyroid hormone, you can get symptoms that mimic anxiety or agitation, things that basically amp you up. So rapid heartbeat, shakiness, feelings of nervousness, sometimes upset stomach, even like increased sweating. So a lot of things that kind of look a bit like anxiety. I'm sure you can see how those would mimic other mental health issues that cause similar symptoms. You said you're on medication, which is great. There's a variety of approaches to dealing with hyperthyroidism. But to be honest, it's a little bit more nuanced than dealing with hypothyroidism. With hypo, you basically take something like Synthroid, levothyroxine, which is a synthetic version of the thyroid hormone, of one of the thyroid hormones. And it just is a supplement. Basically, you take it and it increases your thyroid hormone, and that helps with the situation. With hyper, you're trying to produce less of it, so that's a little bit harder. There are some anti-thyroid medications that sort of reduce the functioning of the thyroid. You can have surgery to fully or partially remove the thyroid. You can use a substance like radioactive iodine to kill some of the cells that produce thyroid hormone. Or you can use medications that sort of, in a secondary sort of way, manage the symptoms rather than the root cause, right? So you're not changing the amount of thyroid hormone, but you're addressing, say, the shakiness or the heart palpitations and things like that. So these would be things like beta blockers, like propranolol, for instance, which might help you to feel less on edge despite your hyperthyroidism. In your case, what you're saying is that your treatment of hyperthyroidism has helped you with your bipolar. And I could see a couple different reasons for that. Bipolar and, the manic side of it, mania in particular, is interesting because in and of itself, it can cause symptoms, but it can also be kicked off by symptoms. So what do I mean by that? I mean that when you have, mania, you might have racing thoughts, you might have trouble sleeping, you might have physical agitation and a variety of other physical symptoms. But if you get those symptoms from something else, if you start to feel agitated or you're losing sleep because of something, those can put you at risk of slipping into mania as well. So, for instance, I work with somebody right now where sleep is a big one. And if they are, say, sick or, having racing thoughts about drama they're going through in their life and they're losing sleep, that's a trigger for me to go, okay, we need to be careful. You might slip into mania here. And so for you, things like family issues or trouble at work or finals week at school, that agitation, might kind of push you over the edge into mania. And so, with the hyperthyroidism, it could be that in some cases, the physical symptoms caused by it do push you over into a manic episode. So in your case, maybe it is that the less intense symptoms are, reducing the amount of that happens. It's also possible, I'm not saying this is the case, I would have to dig much deeper into your situation, but it could be that you weren't really having true mania in the first place and that the hyperthyroidisms were just mimicking that. But either way, you're experiencing some relief now, and that's the most important part. As much as we like to draw clean lines between all the mental health and physical health disorders, the picture can actually be pretty murky. And sometimes what it comes down to is like, okay, I know that you want a really, really clean answer, but how are you doing? Right? Has your functioning improved? Are you feeling better? That's the important thing. Now, just to explain on the flip side of what you've experienced, people with hypothyroidism, so low thyroid hormone, they experience symptoms that mimic depression. So similarly, just in the reverse, right? Things slow down. They feel lethargic, not a lot of energy, maybe feelings of sadness and such, and maybe mental fog, lots of stuff like that. So you asked, what is the impact of thyroid on mood? I think it's one of the primary things to consider when, physical health merges with mental health. The thyroid is a really big one. But there are many other things that could also potentially have an impact. Vitamin deficiencies or vitamin overdoses, to be honest. That's one thing to look out for if, say, you have any gastric issues that mess with your absorption of vitamins or you're taking a lot of supplements. Our bodies really can't absorb that many vitamins. So when you get, these big macro doses of vitamins, the research says that you're actually peeing a lot of it out. And in some cases, it may not be very healthy for you. Obviously, consult with your doctor and look at your particular situation about that. But of course, vitamin changes can cause some physical symptoms that may mimic mental health issues, as well blood sugar issues, kidney, liver functioning, hormonal issues like, estrogen or testosterone issues. Those can definitely impact mood. Lots of different things. So, if you're out there and you're feeling like your doctor isn't necessarily doing their due diligence and they're just sort of throwing SSRIs at you after asking 2 questions, and you feel like there could be something going on medically, don't be afraid to advocate for yourself or to get a second opinion. Go see another doctor. Of course, this, plays into access to care and things like that, but the desire to dig deeper and advocate for yourself or find somebody else is totally valid. And in the end, even if it doesn't show anything, you're never going to regret having some lab work done, right? At least you'll have a point of reference. And then, of course, keep in mind that your mental health is also influenced by the way that your body feels. In anxiety treatment, you might hear about what are called internal cues or interoceptive cues. So when you feel symptoms that seem like anxiety, your body can misattribute them. So, attribute them to the wrong thing. And it'll think that anxiety is happening. Like, oh, okay, your heart's pounding. We must be anxious. And then it sort of sets off that reaction. Same goes for depression, mania, even anger, right? Take the simple example of people getting more pissed off because it's hot outside or they're physically uncomfortable. Their mind could be misattributing that physical discomfort for a threat or psychological discomfort, and then the anger rises up to defend them from it. So, yeah, there's a lot of ways that these things are tied together. And so, kind of working with your providers, teasing things apart, doing a little bit of experimentation and digging to see if there are any obvious physical health issues is very important. So hopefully this gives you an idea of how thyroid functioning can impact mental health, as well as, how they're tied together in general, mental and physical health. Thank you for the question. Good prompt to talk about this. And with that, that is the end of the episode. This has been episode 342 of the Hardcore Self-Help Podcast. If you want to see the show notes for this episode, go to deafthepsych.com/episode 342. And if you want to send me a question for an upcoming episode, send me an email to deafthepsych@gmail.com. All right, guys, enjoy the rest of your day and take care until I get to talk to you again. Bye.